practically speaking. So building up a good public relation with government organizations, government body, large organizations, INGO is must useful. Even they have certain kind of skillful manpower. They have tools like a lot of stretchers. You must have a good public relation with Red Cross also, Red Cross Society of your country. So you should have this kind of public relation to build up a good network, let's say good network, and the team should be prepared anytime, so that they should be committed that if any place disaster occur, this skillful team, those who have already trained, those who are certified, they should be able to move at that disaster zone. So I think this is the answer to your question. Okay, this is another again question from Cheng. I am thank you that there are good questions, and I am trying my best to say you. Actually, all these things I am talking on the basis of experience. So, what always I have felt that until your knowledge or your skill or your willpower is implemented to the society, that is of no use. So, and the questions are also accordingly. So, the next question again is, the disaster is especially challenging for people with disabilities, isn't it? Yes, of course, the disaster is challenging for people and for disabilities. Look, regarding disabilities, what I want to focus that this is a very good question. Already in a community there are disabled people already, and as any kind of disaster occurs, most of the casualties people mostly are affected with their bones. What I have seen that orthopedics department are more crowded than other kind of department, regardless of emergency department of minor injuries. So how do you, if you talk about community medicine, their community medicine has described disabled somewhere as those persons who are not in job. If you are in an adult age, but if you are not in job, they also use the term disabled. Look, but if you are talking about disaster, we talk about mechanical disaster, I mean physical disaster. So so your question was that what are your thoughts or what are your plans for disabilities? So disabilities occurs as an immediate. So how will you handle disaster? How will you handle the disabled people? First, in the part of pre-preparedness, in the cycle that I have shown, in the part of pre-preparedness, what you can do that, okay, this is the most vulnerable zone of that might be of any kind of disaster. If the earthquake magnitude is high at that particular zone, better say that family or say that individual not to, say that disabled individual not to live in that zone first. Second thing, what I would like to say that if they are alone and they are not able to move by themselves, our DRR team should go there, or government representatives or any volunteer should go there and help them to move to another place, migrate to another place. Now, how will you handle disabled person during the time of disaster? So now you need a medical health professional. Now if you even a little bit paramedical, if you go to the pure public health professionals, then I think besides shifting the patient, you cannot handle those kind of affected individuals. So now you need pure doctors and nurses over there to handle this kind of disabilities. So what you have to do is that now again it comes to the immediate wound care method. Now you can fix them with, if there is any kind of hairline fracture, you can do plaster, you can use plaster of Paris at the same time. On the ground level you can put them on some kind of sling or some kind of supportive devices at the same site, same zone. So here you need doctors and nurses for that side, and migration of people for the major, for example, if someone is severely injured, if someone has multiple fractures, if there is chest trauma, then these disabled persons should be taken as an emergency response, and they should be provided emergency relief via ambulance or via helicopter. You should transfer this patient to tertiary level care. I think these were the questions on my side. Okay, one more questions. Okay, thank you for asking a lot of queries. Okay. Okay. Okay, so this is also one of the very good question. One question: Are there enabling conditions in terms of national policies or some national level policies that would immensely help DRR? Yeah, this is one of the very impactful relative. So look, I worked for Ministry of Youth and Sports in at National Youth Council specifically on this part. And look, the presentation might end here in 1 hour, but what I would like to share that the word DRR, disaster risk reduction, is itself it's not so simple term, and it takes around minimum how we train the people by preparing a lot of presentation and training things, and it takes nearly about minimum duration is 14 days to prepare a DRR team. And regarding policies, there should be two types of policies to handle the DRR team. One should be short term policy, one should be long term policy. Short term policy generally focuses on awareness part and pre-preparedness part, whereas long term policy focuses on rehabilitation and relief of the person by visiting the site of disaster. So now if you so one thing you must be, if you are a leader of this team, then what I used to do is that I used to categorize the youth in two groups. First you should select the adolescent age group youths, and then you should ask them that are you prepared for emergency relief, I mean post disaster relief, or are you only willing to prepare willing to serve the society as part of awareness and pre-preparedness. If you are willing to serve the society as a part of awareness and pre-preparedness, that comes under short term policy, and you should provide training accordingly to their interest. Again, if someone is okay, I am a youth, I am willing to go even at the disaster zone, then you should provide them a training, like if they are medical health professional, then they should know how to intubate even the chest tube in a hygienic environment, in a there are mobilized tents, mobilized emergency care can be established at a disaster zone. So for example, chest tube insertion to prevent people to go to high mortality rate, like for example pneumothorax occurs due to chest trauma. So you could make health professionals available for that purpose. Other is that there should be, in long term policy, there should be a group of youth who are ready to mobilize even to different districts or different parts of the country. So in this way I think you can help immensely to mobilize DRR concept through DRR team. And another question again was related to triage. I think this Dr. Nimesh will answer. How can we define disaster related to climate change? Another question I am reading. Why climate change is not hazard but disaster as per your view? Look, hazard is an adjective term. If you talk about a little bit more, if you catch the words, then hazard is an adjective term, and disaster is a kind of, you can say that it pronounces the whole scenario. So the hazardous condition comes under disaster for right now. So your question is that can you define disaster related climate? Yes, this whole presentation was based on climatological disaster. Why the term this? Why even I had I made this topic climatological disaster. You could see what a beautiful word is this, climatological disaster. Disaster induced due to climate. So how did this word catch in my brain, and I thought no, this word should be flourished, I mean enhanced into a particular society. So what I thought that okay, let's give a presentation or training session on this climatological disaster. So how am I going to relate for you? So what I always, while studying and doing research work, what I always felt that coming to the baseline, what is the root cause of this disaster? Either that is landslide, either that is flood, either that is some kind of UV rays coming immediately to our zone, I mean to our place in a community from the ozone layer. Everything is related to, if you have more industrialization and less greenery, I mean you are planting the tree in a very less frequency manner, less number of trees are being planted, where our cutting procedure is in high frequency to build house or to build industries or to build furnitures. This is disrupting our ecology. A chart that in my slide there is one chart there is already mentioned ecological system. So all this climate impact, the climate impact, the crisis that is creating due to either that is related to high industrialization, either that is related to less number of tree plantation. This all has an impact of more carbon dioxide emission than oxygen emission. I mean, as trees, for example, green trees, they provide us oxygen, right? And industry are emitting carbon dioxide. So what is the proportion of this thing? So the proportion is going like carbon, like hazardous gaseous particle like carbon monoxide, say, let's say carbon dioxide from a lot of vehicles running throughout the world, a lot of smoke coming out from the industry. So these all has impact on the ozone layer, and ultimately our ecology is being disrupted, you know. If there is less greenery, you will have less rainfall. If there is less rainfall, you will have more deserts occurring, you know, a new kind of desert. You could see a news in different channels that lands are going barren. I mean, the lands are drying, the oceans are reducing its size. I mean, ocean or river sometime was up to your community, now it's escaping a lot, it's drying, and somewhere again you could see that it's coming near to you, ocean and sea. I could see a news that is coming, that is approaching your village, that is trying to engulf you. And all these things, if for example, if there is a mountain, for example, this is a mountain, if you plant a lot of trees at its base, from base to its top, if it's lacking tree, then the landslide will be prevented. So what I want to I gave you an example that how carbon dioxide or hazardous gas is creating minute holes in our ozone layer. That is disrupting the whole of the cycle of this rainfall, the seasonal rainfall that is regularly scheduled to happen, but that doesn't occur. If you have less rainfall, then there is the scenario that okay, drying of land, that is converted into deserts. If you have not good tree plantation, again the chances of landslides are more. Regarding earthquake, frankly speaking, you need a more comprehensive team to describe about the magnitude, waves and shock waves. So I would not like to go on that part. So of course this climate, if you are not preserving the nature, then this will lead to climate crisis and this will disrupt your ecology.